if something is different than usual, I believe one should get themselves checked, either with a general practitioner or seeing a specialist, whichever way. Somebody should check you. You cannot disregard these things because this is the starting point of many more symptoms to come.
Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's QRATED podcast.
Hi everyone, welcome to QRATED, brought to you by Specialist Centre or UMSC. I'm Nadia Azmi, your host. Welcome back to part 2, where this time we're still on the topic of the heart crisis in Malaysia, but now we'll be talking about UMSC's Heart Advantage, love that, Heart Advantage of cutting-edge care for complex cases. And we are still with Professor Dr. Imran Zainal Abidin, a consultant cardiologist, and also Professor Dr. Sivakumar Krishnasamy, consultant cardiothoracic surgeon. Okay, so let's talk about cardiac care at UMSC. Cardiac care, as we know, has come a long way. What are some of the breakthroughs or treatment or surgical techniques that you can tell us about that you are implementing and using at UMSC?
Okay, latest advances, I would say. There are many actually. There are many. So there are advances in many fields of cardiology. I just take it one by one.
Sure.
Okay. Let's talk about the most common problem, which is coronary artery disease or blood vessels. We have the recent advances is that we have more tools for more difficult vessels and better stents with delivery. More tools need especially to deal with hard calcification of vessels. Vessels, when you have disease, when you have high cholesterol, they tend to be very calcified.
Very?
Very calcified.
And what is that? Can you break it down to us?
It means it becomes hardened, like the macam keras, macam bone,
Right, okay.
Because what the plaque does, it has a cell there, it eats up all the calcium in the blood. It gets accumulated there in the vessel. The word atherosclerosis in Latin means hardening of vessels.
Okay. I wish I had a dictionary here, but it's okay. We have the walking dictionaries here.
It means hardening. So it becomes hardened.
Yeah.
Hardened vessel is always a problem. Problem for him, problem for me. But now we have equipments that can break those hardened vessels.
And for surgeries in particular, Prof. Siva, of course, we know technology has advanced. There's a lot more innovation being used at hospitals. How has that helped what you do?
All right. In a surgical point of view, a lot of our techniques and way we do heart surgery has become very safe. We have got safer techniques in protecting the heart. So the heart is well protected during the time we stop the heart to do the operation. We also can do the operation with the heart beating, and that is called off-pump surgery. We also do nowadays more arterial grafts for patients generally to give them a more lasting graft. The classical conduit that we always use in terms of bypass graft is the left internal mammary artery, but over time we realized that this is a very robust and a very good conduit, and hence we started to explore more arterial conduits using the right internal mammary artery, using the radial artery, rather than using the conventional saphenous vein graft. So here in University Malaya and UMSC, we tend to do more arterial grafts for our patients, and that has given a more long-lasting conduit where the patients live longer with these conduits and they tend not to come back with block grafts or block conduits. Another thing we do in my practice in University Malaya is we do a quality assessment on table itself. So when I've joined the grafts, on table itself, we have got specialized instrument and tool, which is called a transit time flow meter. We test our graft on the spot to tell you that the graft is flowing and working well. and that actually extrapolate to the longevity of the graft. If the graft has got a good flow, has got a very low pulsatile index, these grafts are known to survive. If the graft does go down, it is not surgical related. It's most probably due to the lifestyle of the patient or cholesterol deposits and all. And in this time and age, with a lot of medical legal issues and where patients tend to question, oh, did the doctor do something wrong and that's why my graft got blocked, or did something go wrong during the operation? We have got this evidence to tell them that, in theaters and in the aftercare, your graft flows were good. So if you've got good graft flows, most likely that will last you a lifetime. But of course, there are many other factors that actually can cause the graft to go down over time. But if you're putting more arterial grafts, they are going to last longer. That is what we do in our practice. And that is the practice that has been advocated worldwide. And that is the standard of care we are providing in UMSC. On top of that, we also have the minimally invasive approach for our conduit harvest. Our veins are taken through endoscopic vein harvest, something not many hospitals in Malaysia do. So through a small cut, we get the veins out, faster wound healing, especially for diabetic patients, lesser risk of surgical site infection, and patient goes back home happier with a smaller cut and scar.
The recovery phase is also much faster.
Much faster. Yeah.
Okay. If we rewind a bit, during the early stages of when a patient steps into your office, with this technology being used at UMSC, does it also help you detect earlier heart diseases or heart problems in a patient?
Oh, right. The detection part, Prof. Imran will do it.
Okay.
He sends me after detecting it.
Okay. But does it help you detect it earlier in a patient, whether the patient is young or a bit older? If they come at an early stage with the cutting edge technology that you are already using, how has that boosted the service?
We follow the current European guidelines strictly. Okay, so meaning to say that, number one, we do investigations when it's really needed, and we avoid unnecessary investigations where we think that will not benefit the patient or more likely to cause harm. And for cardiac detection, for coronary artery disease detection, we have adopted to use imaging methods. Imaging methods such as coronary CT angiogram. So we instead of doing the conventional angiogram, we do a CT scan. Which is easier, outpatient, half an hour, and we can detect cardiac diseases fairly fast and accurate. So we have adopted that as part of our screening program. Yeah, and it is widely endorsed in all guidelines.
And Prof. Siva, UMSC is known as a quaternary care provider. What does that exactly mean, especially for heart patients that have complex cases or complex health issues?
Right.
Yeah.
I mean, when you talk about heart patients with complex issue, it goes down to the heart itself, where there are many things in the heart that can be treated surgically. And among the main ones are the coronary arteries and the valve. So when you talk about complex pathology, is like when the patient presents one with multiple problems, or a patient with heart with poor reserve, or patients with complex multiple medical conditions with a heart condition that comes to us. So we are fortunate in UMSC. Well, the term quaternary means here, it's a group of highly specialized and skilled specialists or subspecialists that are available to also help me optimize or basically prepare this patient to undergo a highly complex heart surgery. So it's not only treated by the heart surgeon, but it's treated by a group of doctors to optimize this patient to get the best care possible. I can quote an example, a patient I operated on last week with a heart pump function of 19%, but he has got also an underlying kidney issue, also has got an underlying liver issue. So I've got my nephrologist who has taken care of his kidney. I've got my gastroenterologist who is taking care of his liver. And me and my cardiologist are taking care of the heart. So patient has done well, slowly improving. But these are things that only can be made available in a multidisciplinary hospital and not a single standalone practice. So we are fortunate in University Malaya Specialist Center. We have this facility to allow us as surgeon to operate comfortably, not needing to worry about all the other multiple problems the patient has, because I know I have a team there to co-manage the patient once I've done my job.
And because you're all under one roof, you're able to communicate and talk to each other
Exactly.
easily in a much better manner. So that really helps and benefits the patient
Exactly.
a whole lot.
Yeah.
Now, even with all this technology readily available, of course, prevention is still what we aim for, what we target. So what advice would you give, especially in particular to young people, about prevention, and what role, what difference will it make when it comes to early screening? Yeah, maybe Prof. Imran, you want to start?
Okay, so prevention, yeah.
Yeah.
When it comes to prevention, younger age group, I think the healthy living is what you need to be looking at. Your diet, your sleep pattern, yeah, your physical activity, the chill time when you touch the grass, you know, the way people
Yeah,
always say,
yeah,
yeah.
yes.
So you need to have that. You need to have time for yourself. Yeah. So that is what the person can do to him, to himself or herself.
We talked about also mental health in the first part,
Yeah.
where it's also important for an individual to also take care of the mental well-being.
Yeah.
That is often overlooked because maybe some people, this is just an assumption, they don't believe that your mental state or your mental being will affect your physicality, your physical medical conditions, right? But that's an aspect that we need
It
to look
does,
at.
yeah.
Yeah.
And don't worry about the stigma of being labeled, oh, I'm having some kind of mental disorder.
Yeah. Yeah.
But it's one thing, you're not alone. There are many of among Malaysians who suffer the same thing. And it can be treated, not just with medication. Sometimes we just, talking to someone, talking to a psychologist. But if it's not well treated that way, don't be shy.
Yeah.
Don't be worried about the stigma. Reach out and get help.
And even though early screening is ideal, is what we or you hope for when it comes to patients coming in, that they take that proactive step. But it's not just being shy, Prof. Imran. I think maybe a lot of them are scared. They have that fear in them when it comes to seeing a doctor, when it comes to coming into the hospital. It's like a daunting, outlook for them. Or no, I don't want to find out what's wrong with me. Maybe it's better if I'm, ignorant and oblivious and I'm at more peace. What do you have to say to these people feeling this way?
We won't be doing such the kind of approach to you guys. We will talk to you first, have a chat, just see what's troubling you. We will do investigation. We can always discuss. Okay, don't worry. You can post all questions to us, especially doctors in UMSC. We spend time to listen to you. Okay. We can always discuss on the approach that we need to take. It's not a one way. We don't dictate what you should do, but it's an approach where we put the patient first. Okay, we will discuss what's good for you and what's not, and what do you prefer and what's not. So, boleh bincang lah. The way we will say, kita boleh bincang.
I mean, you as the doctors, as specialists, you have always the best interests of the patient at heart, right? It's always at your priority. Now, Prof. Siva, you are a surgeon. I think maybe a lot of us are also do not like the idea of having to go into the operating theater, not knowing what you're going to do to their bodies and all that. What's your advice to those people, especially the younger ones?
Well, the younger ones, what I would advise them is, number one, be more aware of yourself. In other words, know more about yourself in terms of symptoms or any difference in your day-to-day activity and lifestyle. If you're experiencing something that is abnormal, don't disregard it and just attribute it to, I'm just tired of working, or I'm just tired of doing housework, or I'm just tired of running around with my kids and, so on and so forth. If something is different than usual, I believe one should get themselves checked, either with a general practitioner or seeing a specialist. whichever way, somebody should check you. You cannot disregard these things because this is the starting point of many more symptoms to come. And before it's too late, you may come to the end spectrum of the disease. And sometimes, unfortunately, Prof. Imran and me and my team, we have sometimes turned down patients totally from any form of treatment because they cannot cope with the kind of treatment that they have to actually get if they've presented earlier to us.
Yeah.
When it becomes irreversible, we can't do anything because heart is a group of muscle that once it's damaged, once it dies, it doesn't come back.
Yeah. Prof. Siva, what about patients who come in with complex conditions? They feel like they've run out of options. How would you handle or treat that situation? How can hospital institutions like UMSC give them hope?
Okay, here at UMSC, we tend to practice strictly based on guidelines. We are an academic center. We, of course, provide cutting-edge technology in terms of treatment and care for the patient. So our practice is very much guideline-based. Complex cases are dealt in such manner. We will discuss these cases in our multidisciplinary team, and that's actually a class 1 evidence if you look at all guidelines. And based on that, we sometimes can do what we call as an hybrid approach, a little bit of treatment from the cardiology side and then a more definitive care by me, or sometimes a combination of both, or totally on surgical approach, or totally on percutaneous approach. So there is no yes or no in terms of how we approach them. And with the advent of more and more technology, either catheter-based or surgical approach, combining both actually gives patient the best outcome. I can quote an example. I mean, in recent years, the presence of the transcatheter technology for aortic valve implantation has been there. And only over recent times, we have adopted it in our practice. And that is basically a technology that has been designed for very high-risk group of patients in the elderly age group category to avoid them from going for surgical or open aortic valve replacement. But over time, they have refined the technology. It has become better, and they are extending it more and more for high-risk patients in younger age group, where they can avoid surgery and they just go for a needle puncture to get their valve replaced. So that's what we do in UMSC. And the key thing here I would like to highlight is that we work as a team and we make a decision as a team, especially when it comes to complex cases, because we have a team to do that.
So it's not just one doctor or one specialist making the life-changing decision for a patient. Prof. Imran, you talked about how you have these new technologies like advanced imaging. There's also the wearable monitors. This is technologies in cardiac diagnostics. So how, if you can go into a little bit more detail about how these technologies are actually able to detect the risks earlier, and how do they manage chronic cases very effectively?
Okay, wearables devices. They are used to detect arrhythmias. Arrhythmias means you have an abnormal heart rhythm.
Okay.
And it can vary from something that you can buy, like an Apple Watch. That's a wearable device, to something that we can paste it on your chest. For example, there's a device that we paste on your chest, and then it can detect any abnormal heart rhythm for the period of almost 2 weeks.
Okay.
So all these were not available 5 or 10 years ago, but now we have that, and with that technology available, more rare arrhythmias can be detected. Those that were not be able to detect it before, now it becomes easier. So diagnosis-wise becomes more accessible to us, so that we can give the right treatment. So those are the advances that we have in medicine. It's available in UMSC. Apart from that, what I do, because I'm apart from being an interventional cardiologist, I'm also an electrophysiologist. So I'm a plumber and an electrician.
Wow.
Ah,
Okay.
So I deal with the electrics of the heart. So
Yeah.
these devices that I told you before, they are key in managing patients with arrhythmias.
Mhm.
And recently we've had made some strides in the management of arrhythmias, especially for irregular heartbeats.
Yeah, yeah. And to the both of you, what is your maybe one most single important message that you want to convey out there to Malaysians, to all those watching us, about understanding, about protecting their heart health? Prof. Siva, can I start with you?
I would say number one, lead a healthy lifestyle by taking care of your diet, enough rest, reasonable exercise, and be aware of yourself. I think that is the key thing. Being aware of yourself will actually allow you to pick up more symptoms and problems even better than a doctor. When you find something different in yourself and not the usual self you are, go and get yourself checked. I think that is the key advice I would give.
And how do we stay consistent and disciplined, Prof. Imran?
Consistent and discipline. Consistent and discipline is always being you have to be focused in healthcare, especially for your own health. And one thing to add about the general public.
Yeah.
Okay. You have any health questions,
Mm.
it's best posed to the doctors
Instead of?
instead of social media.
Yeah, yeah.
Okay. So you get thousands of suggestions, and then sometimes it contradicts with modern medicine and the evidence that we have.
Okay.
So reach out. If you have any issues, reach out. And if you think that, can I trust this doctor? Can I, whether he's going to try and get money and do unnecessary tests? UMSC, we don't do that.
Yeah. I think that's what they need to know, because at UMSC, when we look ahead, heart care itself is already evolving in Malaysia. And then, the role that UMSC plays is very important as well in shaping that future. So how would you position UMSC in this revolutionary healthcare industry, especially when it comes to heart care? Prof. Siva?
Well, I think most of the practicing consultants and physicians in UMSC are senior professors. Majority of us are involved in writing major guidelines for the country and also in shaping policies and also practice.
Yeah.
So being in the forerun of the clinical practice in Malaysia, we definitely play a big role in good clinical practice. That means practice with evidence and not practice based on one's intuition. So in that way, I would say we are the forerunners for this. And I think it will only get better with more and more professors and consultants getting more international recognition and international collaboration and getting more mandate to shape the guidelines in the country.
So to our viewers, we have the best specialists at UMSC, the best of the best. Prof. Imran, what about you? What is your take about UMSC's role in the evolving heart care industry?
One thing that UMSC benefits from is its coexistence with UMSC Malaya Medical Center.
Right, yeah.
That sets apart to other private practice elsewhere. And because of this coexistence, the advances that happens in each side will happen in UMSC. And being a teaching institution where we teach master students to become specialists,
Yes.
or specialists to become subspecialists, the level of expertise that we have in UMMC is available readily in UMSC. Now, to some, that to get health attention or to have a consultation in some government hospitals, it's very difficult. Your waiting list is like 6 months, maybe 1 year. But with UMSC, you can have the opportunity to see us much earlier.
That's good news to a
That's
lot
good
of
news,
people.
yeah.
And the coexistence of this multidisciplinary doctors that you have under one roof in one building, I think is something unique. We can point that out. It's important to note that it's something unique in Malaysia that UMSC has, that feature of having all these different experts together, working together. You're a colleague, so you know each other well, you communicate well together, and that essentially will help the patient receive the best treatment and subsequently the best recovery that they can get for their life. So thank you very much to Prof. Imran and Prof. Siva of UMSC for this very interesting conversation on heart disease and heart care. The heart is what keeps us alive. So let's keep that heartbeat going. Remember to go for your regular screening. Don't be afraid. Don't be scared. You have very nice doctors like what you see here in the QRATED studio. And also be more aware of your body in identifying the symptoms. If you feel like something is not right, something is off, make that trip to a hospital like UMSC. So UMSC has all the resources and the support services that a patient needs, besides the love and care that you'll get from the specialist. So yes, please do what you need to do to take care of your body and your health. Thank you for joining us on QRATED. Remember to QRate us by subscribing, following, sharing, and commenting. Remember, the heart is what matters. So take action as early as you can. So stay informed, stay healthy, and stay connected with UMSC. See you then and take care. Bye, everyone.
Did you enjoy today's curated episode? Well, don't forget to tune in for the next episode of Curated Podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insights, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!